What are testes? Male reproductive anatomy for fertility. Imagine a pair of small, oval-shaped organs tucked inside a pouch of skin called the scrotum. These are the testes, also known as testicles, and they are essential for male fertility. Their main jobs are to produce sperm, which are necessary for fertilizing an egg, and to make the hormone testosterone, which influences many male physical traits and sexual functions. The testes are located outside the body because they need to stay a bit cooler than the rest of the body. This cooler temperature is important because sperm production works best in a slightly lower heat environment. Inside each testis are many tiny, tightly coiled tubes called seminiferous tubules. These are the sites where sperm are made through a process called spermatogenesis. This process starts at puberty and continues throughout a man's life, producing millions of sperm each day. Once sperm are formed, they move into a tube called the epididymis, which sits on top of each testis. Here, sperm mature and gain the ability to swim and fertilize an egg. The testes also contain special cells called Leydig cells, which produce testosterone. Testosterone is a key hormone that helps develop male secondary sexual characteristics like a deeper voice, increased muscle mass, and facial hair. It also supports libido and overall reproductive health. The production of sperm and testosterone is controlled by a hormonal system called the hypothalamic-pituitary-gonadal axis. The brain signals the testes to produce hormones through a series of steps. The hypothalamus releases gonadotropin-releasing hormone, which prompts the pituitary gland to send out luteinizing hormone and follicle-stimulating hormone. Luteinizing hormone stimulates the Leydig cells to make testosterone, while follicle-stimulating hormone helps support sperm production by acting on the Sertoli cells inside the seminiferous tubules. Healthy testes are vital for fertility because they ensure a steady supply of healthy sperm and enough testosterone to support reproductive functions. Factors like injury, infections, hormonal imbalances, or certain medical conditions can affect testicular function and fertility. For example, if the testes do not descend properly during fetal development, a condition called Cryptorchidism, it can lead to fertility issues later in life. During fetal development, the testes form near the kidneys and then descend into the scrotum. This descent is important for proper sperm development. If the testes do not descend, it can increase the risk of fertility problems and testicular cancer. Maintaining healthy testes involves good overall health, avoiding injury, and managing medical conditions that could impact their function. In summary, the testes are crucial organs that produce sperm and testosterone, supporting male fertility and sexual development. Their function depends on a complex balance of anatomy, hormones, and physiological processes. Understanding how they work helps us appreciate the importance of reproductive health and the factors that can influence fertility. If you have concerns about testicular health or fertility, it's always best to consult a healthcare professional for personalized advice and testing.